Hello, everyone, and thank you for attending this afternoon's webinar, What are the Homocystinurias? A Panel Perspective. My name is Danae Barkey, and I'm a patient with Classical Homocystinuria and the Executive Director of H2 Network America, and I will be your moderator for today's event. If you were able to join us at the Bethesda conference earlier this year, you might have seen Dr. Kimberly Chapman present on the same topic, but from a clinical perspective. I'm going to pop open my screen here really quick. In her webinar during the conference, Dr. Chapman was able to share our infographic that talks about the inheritance patterns, symptoms, markers, and recommended treatments, noting what really reunites the homocystinurias is they all have elevated or high levels of homocysteine. Well, we will link to Dr. Chapman's presentation in the description of this video when it is posted online, along with a link to the infographic. Today, we will be focusing on what are the homocystinurias, but from a caregiver perspective. While homocysteine might look like it's the only thing in common, there are many other things that we share together. I'm going to end my share screen. Stop share. And we are going to get started. So I would like our panelists to introduce themselves. I will start with Liz. If you could introduce yourself, your child, the condition they have, and if you feel comfortable, where you are from.
Yeah. So hey everybody, I'm Liz. My son Elliot is 6.5 years old and he has classical homocystinuria and he is partially responsive to vitamin B6. And we are in South Carolina.
All right. Misty, could I have you introduce yourself? Oh, you're muted.
Hi, my name is Misty. My daughter Sienna is 24. She has MMA CBLC with homocystinuria, and we live in Texas.
All right, wonderful. Thank you. Brittany?
Hi, I am Brittany, and I have a son, Grayson, who's 3 with Cobalamin C, and we live in Colorado.
All right, and Grace. Oh.
Hi, I'm Grace. I have a daughter, Carson, who's 2. She has severe MTHFR, and we're in Florida.
All right, thank you so much to our panelists for joining us today. For this great conversation that we have ahead of us and in store. So now we're going to go in a little bit to the diagnosis journey. So I'm going to give you each a little bit of time to share about if you had newborn screening for your condition, if it was on. I know when I was born, there was no newborn screening, so by default, we were missed. And if you could talk about some of the symptoms that they might have had prior to diagnosis that led to the journey, and what it might have looked like to see the different doctors, how long between symptoms and starting to see doctors did it take to get the diagnosis, and an explanation of how you felt when your child was diagnosed. Again, we'll start with Liz.
Yeah, so Elliot was actually, he passed his newborn screening tests, or so we thought at the time. And it wasn't until Elliot was 2.5 that he got sick with what we thought was a just typical virus. We had been on a family vacation, so we thought, oh, you know, he picked it up somewhere or whatever, and it'll pass. Well, a couple days go by and he's not getting better. He's actually getting worse. He looked like he was just sleeping just from sun up to sundown. So we took him to the ER, and the doctor in the ER was actually pretty dismissive and gaslit me a little and kind of just said, listen, Mom, you're overreacting. He's fine. We were able to get him fluids and they sent us on our way. Well, later that night, I'm looking at Elliot and I'm just like, something is wrong. You know, I just felt it in my bones. My mama heart was telling me like something's not right. So we got back in the car and headed to back up to that same ER and said, we are not leaving until you run every test you can run. So they literally ran every test they could run, and were asking all these questions. You know, has he touched any reptiles? Has he been in a communal pool? And I'm like, well, yes, my parents live on the lake. Yes, we were just at the beach, and he's a little boy. There's no telling, you know. So clearly they just had no idea what was going on. They determined pretty quickly he was having seizures, just rapid fire. And from there determined he had clotting in his brain, and that had resulted in a stroke as well. And so at this point, they put Elliot on, put him in a coma, and told us, you know, we may lose Elliot to this. We may never know why. This is serious. So that was when mission figure out what's going on started. I was like, no, we're going to figure it out. So I was at the rounds every morning with the doctors in the ER as they came around, taking notes and, you know, asking questions. And it was maybe a week and a half, 2 weeks later, had looked at one of his blood tests, and his homocysteine level was very high. And they said, we think he has something called homocystinuriia. I'm like, what? What is that? So of course we Google it like everybody else does probably when they're first given a diagnosis. And yeah, turns out we changed his diet that very night in the hospital. We had a dietitian come in. They kind of gave us a crash course on all things treatment for HCU. And within a matter of days, we watched Elliot come back to life. So we confirmed the diagnosis of classical homocystinuria. Turns out my husband and I are both carriers, and Elliot was missed at newborn screening. So because of the setbacks with the blood clots and being in the hospital for so long, Elliot did have to go through some physical and occupational therapy, along with other things, but he is happy and healthy today and thriving and all of that. But to just kind of back up and go over how I felt, I was relieved when we got a diagnosis. I celebrated a diagnosis because in our case, that meant an answer and a plan, and we could move forward with the treatment because I heard the word treatable. It's a serious but treatable condition. So on the other side of the coin, Elliot was missed at newborn screening. And so that was a very frustrating thing. I knew nothing about newborn screening at the time, other than it would happen. But I have since learned that, yeah, Elliot was under the threshold in our state to meet the requirement to test positive for HCU. So I could go on and on. I think that was really all you asked for right now. But yeah, that's propelled me into very passionate work with newborn screening because apparently about half of babies that we know of are missed at newborn screening with classical homocystinuria. So Elliot was one of those.
All right. Thank you so much, Liz. We'll dive into a little bit here to hear more about what it's like for him on a day-to-day basis here. Misty, would you be able to share what your newborn screening experience was like, and if she did experience any symptoms before her official diagnosis, and how long it took to get that, and same questions essentially.
Okay, well, in 1998, there was not newborn screening in the state of Texas. When she was born, she was very tiny. She was only 4 pounds, 15 ounces. She had failure to thrive is what they, originally diagnosed her with. We were sent home on, normal time, but she just was very, very lethargic. She had really poor feeding. And she was also during that time diagnosed with reflux. She ended up having to have surgery for that. But I just kept going back to the pediatrician because I just felt like something wasn't right. I just had a feeling. And finally, I went back one day and the nurse practitioner took one look at her, and she said, you need to go to the lab and have labs drawn right now because she was very pale. Well, they thought that the reading was wrong. So they sent us back again because her, she was only at a 6, her hemoglobin. So she was very anemic. And they called me and they said, you're going to see a hematologist right now. So we were sent to a hematologist. He looked at everything. He said, I don't think it's cancer, but we need to find out what's wrong. So they admitted her into the hospital. And at that time, she was 2.5 months old. and they couldn't figure it out. They were doing tons of tests. I had one doctor, she was a gastroenterologist, and she said, I think it's a metabolic disorder, but it's going to be really hard to find because there's many. So in the meantime, Sienna went on a ventilator. Her red blood cells were fragmenting. She went into total organ failure. And that night, the night before she was diagnosed, they said, call everyone that wants to come see her because she's not going to live through the night. So anyway, she ended up living. And the next morning, we got a diagnosis, and I knew it was bad because they had the chaplain in there, and they told us what it was. And they did not have a metabolic hospital staff. So we were care flighted all the way to San Antonio. We live right outside of Dallas. So we were care flighted to San Antonio. And the internet was fairly new. So the metabolic doctor that we saw, she was amazing. She came in with some literature and she said, this literature doesn't look very well, very good, but we don't make that decision whether she lives or not. So she said, that's not up to us, that's up to God. So we stayed in the hospital for almost 3 months. And, we were told we didn't know if she would have brain damage. We just have to wait and see. So she had occupational therapy, physical therapy, all of that, all kinds of therapies, speech therapy until she was 3 years old. And, she does have brain atrophy, from her not being diagnosed early. And also she is severely vision impaired.
Thank you so much for sharing, Misty. We'll go take a deep dive into living with homocystinuria and giving all that you and Misty have went through. I'm sure there's a lot more to share too. So thank you so much for sharing your diagnosis story. Every time I hear each of these stories, it really just, it hurts all over again. So thank you. Brittany, would you be able to share your diagnosis journey? And I might have to take self off screen.
Yeah, like I said in introductions, I do have a son, Grayson, with Cobalamin C. He's 3. But that's actually not the beginning of our journey. Our journey really began in 2011. My husband and I were living in upstate New York, finishing college, and we were welcoming our second child into the family, a little boy. And uncomplicated pregnancy, newborn screening came back totally fine. Honest to goodness, I didn't really even know what newborn screening really was. I knew that they did the heel prick, but never was I ever concerned about it. No one in our family ever had any issues with metabolic disorders or any genetic disorder whatsoever. And we had a lot of concerns for our son. So just answering the question of symptoms, it's amazing to me how, even though these are different diagnoses, sounds so familiar. Failure to thrive. And he wasn't eating, he was sleeping all the time, like your son, Liz. And we had all these concerns for him, and the doctor just kept telling us, oh no, he's fine. He's just a baby. Like, babies need to sleep. If he's not hungry, don't worry about it. And but just like Liz, that mama gut, you feel like something was not right. You look in his eyes and you say, like, there's something going on. When he was 2 months old, he suffered his first, what we now know of as a seizure. He stopped breathing, turned blue. Seizures in infants look a lot different than adults. They don't tend to shake or have anything. It's very different. And so we had no idea. And the doctors didn't know. We went to the emergency room and they said, oh, he just has acid reflux. It's not a big deal. Take him home. Still, my husband and I both felt like something is wrong. Like, they're not looking at it the right way. About a week later, he had another major seizure, stopped breathing. We called the ambulance, and the EMT that showed up to our house said, your son is having seizures and it's something really serious. Like, you need to get to the hospital. And that was the first person that ever was an advocate for us, ever. And so we fought our pediatrician that night to get directly admitted to the hospital. It took hours. They refused to put in even an IV line. They didn't hook him up to any machines, nothing. And so we spent the night at the hospital in the back room, somewhere, just basically they were ignoring us. And the next morning he suffered a major seizure. And again, he wasn't hooked up to anything. He was just, which I'm pretty sure was against hospital policy. And I yelled for the nurses. And when they finally came in and put the heart rate monitor on, he was coding, he was crashing. And they were able to revive him. It took about 15 minutes for them to stop the seizure because they didn't have an IV line or any way to give him medication quickly. And finally, someone came to the room and said, "We think something really serious is going on with your son." And my husband and I were like, "Yeah, we've been trying to tell you that for months." It's so frustrating. And so they did just a battery of tests similar to Sienna, Missy. They did an MRI and found severe brain atrophy. He was eventually put on a ventilator as well because his seizures were out of control. But it basically came down to, it took so long for us to even get the medication at the hospital. And we had to fight pharmacies and we had to fight insurance company to get the medication. He passed away at 3.5 months old. And that's really where our journey just kind of to find out answers started. And we really didn't find out a specific diagnosis until 10 years later when our son Grayson was born. So we did some genetic testing after Drew passed away. And we had kind of a vague idea. We knew it was a homocystinuria, we just didn't know which one. And we finally, when Grayson was born, the doctors at Children's listened to us. And we said, look, we know that even though he had the same 2 genes that Drew did, we know it's a possibility that it doesn't match up, but they were so good about listening to us. It was the first time any doctors had ever listened to us. And they said, well, if he doesn't end up having homocystinuria, great, we'll just send you home with a healthy baby. But if he does, then at least he's here and we can figure out what's going on. So long story short, after just 3 days at Children's, after, an 11-year battle of trying to figure out what had caused our son Drew to pass away, Grayson was diagnosed with Homocystinuriae Cobalamin C. So it's isolated homocystinuria, meaning he only has homocystinuria, not methylmalonic acidemia. And he's been treated since day one, and he's amazing. He's thriving, and he's amazing. So, our story, unfortunately, it sounds so much like Liz and Missy's. Unfortunately, ours ended in tragedy. I'm glad that both your kiddos are still here and fighting, doing amazing, but that's why we advocate for all our families.
Thank you so much. Okay. This is exactly.
I didn't mean to make you cry, Janae. I'm sorry.
I am an emotional person, and I'm very willing to admit it. And, it's just all the more reason why we, still to this day, 2022, Sienna obviously was born, 22 years ago, and we're still facing the same unfortunate realities today in 2022. So this is just all the more reason why we all need to use our voices and advocate, because it might be great in your state, but it doesn't mean it's like that across the country. And so we are so thankful, though, that Grayson was able to get that early diagnosis and intervention. It's a true testament of what newborn screening can do. Grace, would you mind sharing your journey to diagnosis with us?
Yeah, so Carson, she's 2 years old. She has severe MTHFR. So she was actually picked up from the newborn screening. It was when she was about a week old. I get a call actually from the metabolic specialist that she now sees, because of course it was a Friday. The pediatrician's office was already closed, and they call me and they tell me that the newborn screening was abnormal, and they're throwing all these words out that I have no clue what they are. Homocystinurias, methionine, and I'm completely lost trying to write down every single thing possible. But they said it's probably something was wrong with the newborn screening. I guess the newborn screening is very sensitive. Maybe there was a smudge or something, but we needed to get it redone. So I called the pediatrician, and after hours numbers, get him to meet me at the office so that I could go right then to get it. The second one, abnormal as well. And so I'm told that we need to go to our closest clinic about 4 hours away to learn about homocystinuria and get additional testing. So she was initially picked up, through that newborn screening, and the genetic tests and the high levels later confirmed it was severe MTHFR. So she was about 3 weeks old when she actually started treatment. So between the 2 newborn screenings and then getting the labs back from when we went to the clinic, it took about, and then insurance to get the betaine, it took about 3 weeks. So within those 3 weeks, she was having symptoms, but I didn't put 2 and 2 together at the moment, as she slept all the time. She did have troubles eating. I could never get her to finish a bottle, or also I was trying to breastfeed. So it was a lot of unknowns, whether, she wasn't gaining any weight also. And I remember bringing up to the pediatrician that she is not gaining any weight, but oddly, he wasn't too concerned with that. And so she didn't gain any weight for those first 3 weeks, not a single pound. So she was nonstop sleeping, wasn't eating well, and she also had microcephaly. So it was months before her head was ever on the growth chart. And so when she finally started betaine, she was more alert. She was starting to become a whole new baby. And I noticed her eyes, she couldn't focus. She kept rolling her eyes up. I have a video where she's staring at me, she's trying to look me in the eyes, but her eyes keep rolling up. I sent that to her metabolic team. They said to bring her to the emergency room, because once again, it was on a Friday. Pediatrician office was closed. Always happens that way. Well, they believe it was seizures, like a seizure-like activity. And I believe I saw 3 seizures that day. The ER doctor also agreed that it looked like a seizure. So we were flown to her clinic. Still don't quite have an answer for that. They couldn't explain it. All the tests came back normal. And within, through the weekend, I remember that was the first time that I looked at her and she actually stared back at me. And this was when she was 3 weeks old and she was looking in my eyes. I just remember that moment. I was so excited, like, look, she's able to look at me now. So she was caught through the newborn screening, but she still had symptoms that I thought she was a really good baby at first, sleeping really well, things like that. But I noticed a difference after starting the betaine. And so, like I said, those first 3 weeks, she didn't gain any weight. But within 1 week of being on betaine, she gained over a pound. Still blows my mind that the pediatrician wasn't concerned with the lack of weight gain. We went out and bought our own scale, tried to configure it to weigh this little 7-pound baby to figure it out. And we noticed a few delays for the first few months. It's like she lost those 3 weeks. She was consistently a month behind developmentally for like the first year or so. But now she's doing much better now. So our journey to diagnosis was a bit different, but I'm surprised at how many symptoms were there, even within 3 short weeks. Newborn screening definitely changed everything for us.
Thank you so much. I'm going to just bring back up that little flow chart that we had here, just to kind of go over kind of a quick overview why newborn screening looks a little bit different for some of these conditions too. So there's this part here in there called biochemical markers. And in classical homocystinuria, you have elevated homocysteine and elevated methionine. And then for the cobalamin disorders and MTHFR, you have elevated homocysteine and low methionine. And then for combined cobalamin disorders, which have high homocysteine and methylmalonic acidemia, they'll also have elevated MMA on the newborn screen. Why some patients are not detected is because not all states test for the same things. All states will test for classical homocystinuria, but they will set their methionine thresholds at different levels. So you might have a state who has a methionine threshold of 40, or you might have a state that has a methionine threshold of 100. In the case for the low methionines, not all states have a low cutoff. And then they might have additional things like methylmalonic acid or another thing called C3. And so our state newborn screenings are not uniform. And I think that's a really important note. That's why Carson was able to be diagnosed in Florida, but if she was born in, say, Georgia, she likely would have not been diagnosed because Georgia has a different newborn screen and they don't include a low methionine threshold as an example. So depending on where you live will depend on the type of newborn screening that is available. And so if you are interested in advocating for newborn screening, we are here as one of our pillars for research to help you with your advocacy. So please reach out to us. So I'm going to stop my share again. And we're actually going to move into talking about what it's like living with the homocystinurias, and that is highlighted here in the symptom section. And you can see actually almost all the homocystinurias are affected in the central nervous system, the vascular or heart, and then the skeletal systems and eyes. So there's quite a bit of overlap in the symptoms, but you'll hear from our panelists in kind of how they all look a little bit different here. So we're going to go back to our panel here. And if you guys could talk about what types of treatments you've tried and are currently doing without getting too specific, because one thing that is a disclaimer here is all patients' treatment is going to look a little bit different based upon their enzyme activity, and just how their body responds, their age, their height, their weight. There are so many different factors. And so things that we discuss here today do not change any of your treatment. Based upon what you're hearing, consult your clinic. And then if you guys could talk about what are some of the biggest obstacles in your child's journey, either with doctors, schools, sports, families, careers, life after high school in Sienna's case. What are some of your successes and what are some resources that have helped? So there's quite a bit here to dive into. So I was thinking actually this time we would start with Misty. Would you mind going first?
Okay. So for us, when we came, after she was released from the hospital, we immediately, started seeing a metabolic doctor in Dallas. Why we weren't sent there, they said they called them and they never got the message. But anyways, so we started seeing him. I was very pleased with, treatment that I got. But we ended up going to NIH in 2014, and Sienna was not on the concentrated form of hydroxycobalamin. And so I think that really upset me when I found out that, she could have been on that for many years, because that was 2014 and Sienna was like, she was, older, a lot older, 13, 14, 15 years old. I mean, so, she has brain atrophy. She has, cognitive impairment. She functions more probably around the age of a, 14-year-old, probably. She graduated with her class, though. She was in resource classes, but she did it, end up graduating in 2017 with her class. Her vision impairment, her severe vision impairment has been really hard for her. I feel like that with the cognitive is really school was very hard for her. And so she takes every day, I give her a shot of hydroxycobalamin. She also gets 12 grams of betaine powder a day. And those are the only things that she takes for her metabolic. She also was diagnosed with non-compaction, which they're finding out, NIH is finding out that a lot of the Cobalamin C patients do have a form of cardiomyopathy. So she was diagnosed probably in 2015 with that. So she takes medication, for that as well. But metabolically, she, her numbers can be high. Sometimes at times they've been, in 120, 130. Her last labs, her homocysteine was like at a 62, which is, pretty good for her. So, but metabolically, she does really well. She has other challenges, she has a lot of migraines and a lot of other, health conditions, and it does make her feel, very tired. She's very lethargic. She just doesn't have energy like a normal, almost 24-year-old, would have. So, but otherwise she does pretty well.
Mm-hmm. Would you be able to talk a little bit? I'm just wondering, I know that she just started like in I don't know if it's like a school or, would you be able to share a little bit, just because for our families who have teens that are in the Cobalamin family, a lot of them wonder, here quite often is like, well, what do I do with my child after high school? Like, what are our options? So can you tell us what that looks like for a patient as an adult?
Yes. So we found over the summer, we ended up finding a private school. It's for children and adults with disabilities, all types of disabilities. And so she only goes 2 days a week right now. That's enough for her, but it's wonderful. They do, it's continuing education. So, they're doing math and science, all of that, but they also do a lot of extracurricular activities. She goes bowling every Friday, which she loves. It's Christian based, which I love. So they do, a Christian lesson every day. They do cooking, they exercise, and she's just loving it. She's just thriving in that environment. She's around other people her own age, and we're just loving that, because really Sienna she's not able to work because of how ill she is. So her day just consisted of her just sitting here, not being able to do much, especially with her migraines. But now that her migraines seem to be a little bit better under control, she's just loving this program. So I think it's amazing, an amazing program. And I'm so happy that we found it.
That's awesome. It's exciting, I think, to hear that there are programs out there,
Yes.
that, you don't graduate high school and then sit at home for the rest of your life, because
Right.
no patient wants that and no parent wants that either.
No.
And so I know with, there's different organizations around the country, and I know we're working on that as an organization, but trying to help identify after high school opportunities for patients that, aren't necessarily, college is not their path, but there's a lot of different paths that are out there. And so I'm so glad Sienna found something for herself after school.
Thank you.
Let's go to Grace. What does your daily life look like with managing MTHFR, and kind of what have been your obstacles, what have been your successes, and what does treatment kind of look like?
Okay, well, so Carson right now struggles with the 2-year-old, is trying to get her to take the very disgusting betaine, mixing it with different things. I noticed when she's sick, that's a big problem. If she has any type of postnasal drip, there's a much higher chance that she's going to throw it up. So we go through a lot of that. Even just recently, just a small bit of congestion will cause it. So through the 2 years, also when earlier this year, she was sick for a while. She wasn't eating or drinking. I keep noticing these eye issues. It's so frustrating. The doctors do not have answers where her eyes are rolling to the left. That's one of those things, had all types of tests. I still believe it has some type of seizure relation, not positive just yet. But anyway, so she's a perfectly healthy-ish, 2-year-old right now. She has suspected apraxia, so she's having trouble. She's not talking much. There's a few words she'll say randomly. And I also noticed there's a delay in waving and clapping. She was well over a year old before she started doing those things. So she's, but otherwise she's doing really well. She runs around like any other 2-year-old, climbing on everything, getting into everything like a typical 2-year-old would. She's a handful in that. She likes getting into things she can't. Medication-wise, she's on betaine, folinic acid, and Deplin. The folinic acid and the Deplin, those have been a struggle with her doctors. I'm reading these articles that say how important it is to be on those. Talking to other families who are on that. Carson was only taking betaine for the first 1.5 years of her life, on nothing else. And I'm talking to all these different families and reading these papers. I'm wondering, why is she not on other medications? So it's probably about April of this year that she finally started folinic acid. And it wasn't until July that I finally convinced her doctors to start her on Deplin, which is 5 MTHF, which is very important for severe MTHFR because that happens after the enzyme issue. So how else would she get that? And so since then, since starting that in July, I've noticed so much improvement in her speech. I've heard her say hi, bye. She's saying mommy almost consistently. That wasn't until August that she started saying those things. After she was 2 years old, she turned 2 in June. So in just a couple months ago, she started talking after only a month of being on Deplin. And so she's, for the first couple years, she was in physical therapy because there was a few delays there that was happening. Like I said, she was about a month behind with sitting and rolling and all of those things. And then around 7 months old, she caught up. She did so many milestones within 1 month. She finally caught up and has been doing fantastic motor-wise since then. But she is in speech therapy right now, suspected apraxia. So we're trying to learn signs, but remember, she also had those issues with clapping and waving. There's some type of disconnect. She would stare at us trying to figure out, how is that happening? So some of her signs look a little different than, how they're supposed to. I'm trying to think, did I miss a...
I think you have most of them. I think we talked about treatments, kind of the day in the life, the struggle with betaine. I think that's so many toddlers who take it.
For her, yes.
And those, the obstacles and successes. And I think that's one of the things that I know for myself is like, we do have conversations in the community about what everyone's taking. And I know I did that too. And, I always went back to my doctor and like, what do you think about this? And it's like, where are you getting these thoughts? And it's like, it's good to have these conversations with other families, because in many cases we are one of, we might be the only family in our clinic, or we might be one of 3. And so they don't have necessarily the same amount of experiences when we're talking. So I know my clinic was always very receptive to, the things that I wanted to talk about and try. Sometimes they could give me a clear explanation as to no. And sometimes they'd be like, oh, I never thought about that. Like, why not try that out? So
And that's what I wanted, some type of back and forth. Tell me, why wouldn't it work? If there's a good reason, that's, but I still want to present it. Tell me why it wouldn't work. And but I found out, they've used Deplin for other patients, but why wasn't Carson?
Yeah.
And I still never got a clear explanation of why, but she's doing well, and they're upping the dose to what an article is talking about. So it's long run, it's better now.
Yeah, that's great. We did Missy, we did Grace. How will we go down to Brittany?
So obviously our experience with Drew was much different with Grayson. It was very compact and at the hospital. But I feel like a lot has changed in the last 10 years. The hardest part, I think, for us was giving Grayson an injection every single day. It's hard to do to your little baby. They don't have a lot of fat to inject that in, so it hurts sometimes. But we do his injections of hydroxycobalamin subcutaneously with the high concentration B12. And I know that a lot of families, it's kind of back and forth between which one is better. I don't think there is a better one. I think it's just different. So the injections have been hard. We used to have to, my husband and I would have to hold him down, and I'd have to give him the injection, and that was heartbreaking. Like, we'd all end up in tears because it just is hard to do to your baby. The Cobalamin Steering Committee actually wrote a little social story for kids about giving a shot. And as soon as the illustrator was done, I printed my own copy off and brought it home. And we have read that book like every single day for months, until like now he's like good. Like, he knows his injections make him a superhero. So that resource was incredibly helpful. We went through the phase, Grace, too, with the betaine. We have probably the best sippy cup collection, like trying to bribe him to drink his medicine. And I'm telling you, this kid probably knows more drinking games than most frats, fraternities and sororities, because, we get like the little Dixie cups, and he'll drink it and then turn it over. And then we like stack them up in a tower. So it's like, you have to be so creative with little kids, right? Because we always want the medicine to be positive. So we're trying really hard on a day-to-day to make it a positive experience for him, so that as he gets older and might start to do some of this medication on his own, like, it's a positive thing for him. He just started preschool, and we haven't encountered a ton of issues there. Thankfully, he's a great preschool team. He's only there for like 2.5 hours, and he doesn't take medication there. So that's been nice. He does, similar to Carson, he struggles with motor planning, and it kind of affects a couple of areas. Speech is a big one. So same thing. He never liked sign language. Fine motor skills seem to be difficult. And the way that our therapists have described it is, his brain is operating on a Microsoft, but his mouth and his hands, like actually articulating those things, is operating on Word, and they don't exactly correlate together, right? Or a Mac and Word. Does that make sense? So 2 different operating systems. And so it's just like trying to figure out how to connect those 2 to work together. And so, and I think that has a lot to do with like the apraxia. It's very similar. And so he is talking. It took a really long time though, and he was really frustrated, but he is just a little hard to understand, but he understands everything you say to him. He just can't always tell you what is on his mind, which honestly sometimes was kind of nice in the beginning, because now when he tells us what's on his mind, I'm like, I don't want to know. So just kidding. I love it. It's wonderful. But it, the day he learned how to say no was like the best day for him. So he was pretty excited. Other than, daily life, I don't work outside the home anymore. I'm not sure if I'll ever go back to work, just because I always want to make sure that, all of Grayson's medication, honestly, handling all the insurance and all the medications and all the doctor's appointments up until now has been like a full-time job. And I know things will change in the future. We just really we're trying to stay ahead of the game rather than, just being reactive to things as they occur. So trying to get him involved in different things that we know are going to be really helpful for him in the future. Which I guess because we have that, thankfully we have great families who have older kids like Misty who share their knowledge with us and help us know down the road things that happen. So it kind of allows for us to be able to kind of make plans about, where to help him out. And so, but he's doing really good. He takes, the hydroxycobalamin injections. He does betaine. We found that breaking it up into multiple doses throughout the day, as much as I hated having to give it to him multiple times, is actually easier because it's a little bit less medicine and it kind of doesn't, instead of all of his system at once, kind of slowly is through his system throughout the day. He takes the folinic acid, and we also are kind of experimenting with methionine. And I say experimenting only because there's really no research showing that methionine, we aren't really sure if it's effective. His levels in his blood for methionine are very good with his methionine supplementation. He's usually right up in the 40s, which is a high normal, which is good. We have no idea how much is actually making it to his brain. The only way we could find that out is if we did a CF, the spinal fluid measurement. And I have absolutely no interest in him getting a spinal tap right now, considering he's doing so well. We did an MRI when he turned 3 and no brain atrophy whatsoever. I mean, his brain is developing normally. So it's amazing to me how, why I advocate for newborn screening. Just the difference between our 2 sons born with this exact same disorder, same genetic mutations, but the only difference is the treatments were given to him and they were available when Drew was born. Just no one gave it to him in time, so thankfully, toddler years, Grace, I feel you. Those were rough years. And he has his rough days when he's sick too, but for the most part, he's really doing great with taking his medicine. So
awesome. Thank you so much. It's always so exciting to see the kids doing so well, especially when you have the horrible contrast. And so again, it's another testimony to, what that early intervention can do. And also being connected with early childhood intervention within your school district or with your pediatrician. So you get those additional resources connected in place to help kind of fill in some of those gaps that just, they happen naturally anyways, but, they're more at risk with the homocystinurias.
That's right.
Would you like to?
Can I answer one? So there was just a question that came through. I know we're going to hold it to the end, but can I just make one comment because it has to do with daily living? So someone asked about how it's like living with a low protein diet. So as a commentary, as a child with a cobalamin disorder, the dietary management, so they should not be on a low protein diet. So Grayson is not on a low protein diet. We obviously try not to make sure that he doesn't drink protein shakes, right? He doesn't take excessive amounts of protein, but no, he doesn't. We don't restrict his diet. We just try to make sure he eats a healthy, well-balanced diet. What you would normally do for your child. So go ahead. Sorry.
I appreciate you clarifying that though, because I think that is one of the big differences. So primary treatment for classical non-B6 responsive is low protein diet medical formula. Cobalamin disorders, so what Misty's daughter and Brittany's son have, cobalamin disorders, they're treated primarily with hydroxycobalamin and betaine, and there's some other things that are kind of maybe things in the literature. And then for severe MTHFR, right now the literature only states really that betaine is the only known therapy, although as Grace alluded, there are some things that we still think might work, but they haven't been tested in a large enough population, which is hard when there's only 50 documented cases in the entire world. So we're working on those things though. They are coming along, and we have a wonderful team like the parents here that are helping lead the way. Liz, would you like to talk about?
I will speak to diet. Let's talk diet because I'm gonna hit that hard because that is a challenge. And actually, I just recently learned that the cobalamin disorders were not treated with low protein diet. That was new to me. But yeah, so Elliot, again, he's 6.5. His daily regimen is he is allowed 11 grams of protein through food a day. He takes a medical formula, which is the bane of our existence. It's even worse than the betaine in my, well, who am I to say, but in my opinion, it's really hard for him to drink. In fact, we're still orally syringing it to Elliot because he can't, his gag reflex is so strong, he can't drink it. We've tried every trick in the book with sippy cups and straws. And so we literally, every little sip he takes is we pull the syringe, put it in his mouth. He's like a little baby bird. He just knows it's coming. And now that he's in school, he's in 1st grade. He does go to the nurse's office to get some medical formula, and she does that for him there. He also gets one of his betaine scoops there. So yeah, there's the medical formula. He gets 4 scoops of betaine a day. He's got the 11 grams of protein through food, and he's got vitamins B6, B12, and folic acid. So I have become quite the master mixologist over the last few years because we're constantly mixing and concocting things. He can't yet swallow the pills. We're going to work on that soon. So we dissolve them in water, crush them up, oral syringe. So yeah, it, like Brittany said, is a full-time job in and of itself, just managing medication, diet, formula, all that. So let's talk diet. So yeah, Elliot can have 11 grams a day. That is not much. If you've ever counted protein, we do count, actually we count methionine. We were kind of just taught that way to count methionine, and we were told it's roughly 15, I guess grams is the unit of methionine per 1 gram of protein. So that helps me do math a little better versus dividing up a gram of protein. Anyway, so yeah, Elliot lives on the same foods every day. He's very picky. He lives on Ritz crackers, little fruit squeezy pouches. Thank God for coconut milk and all things coconut milk made. He loves coconut milk yogurt. Basically just snacky junk, which is a challenge for us because I want to know that he's, getting nutrition, but I have to just make sure that he's fed and that he's full too, and that he's staying with his protein allotment. So the diet is a big challenge. He lives on French fries. He is a French fry connoisseur, like so many of our other Classical Homocystinuria peeps. And yeah, it's challenging. It has worked for Elliot. His numbers are good. His homocysteine level hovers somewhere. We hit the normal range for a while, and he's now in like the 30-ish range. So the treatment has worked for Elliot. It's not an easy life. It's not an easy lifestyle. So I think I answered most of that. He plays flag football. He plays basketball. He never stops running, moving, going. Every time I look at him, I'm amazed at what he's doing after what he's been through. But I will say I do worry about the future or what could happen. Elliot has had a random seizure or 2 fire off since his initial hospitalization, and that throws us for a loop every time because we never know why or when or any of that. So yeah, other than just the challenge of the treatment itself, we live a pretty good life.
Thank you so much. And I think that actually segues very well into our last section here. If I could give you guys each a minute here really quick, just to kind of talk about the future, things that you find really exciting, about, maybe something that's happening in the research area or clinical trials, things you hope for your child's future, and what advice would you give to new families who have just received their diagnosis. So Liz, I'm going to actually go back to you, and we'll go that way.
Yeah, I am so excited. I feel like we're living in such good times. I'm grateful that Elliot, is living in a time where I do think he will have many treatment options in his hopefully near future. So I am really excited about the fact that there are active clinical trials right now going on for classical HCU. yeah, that's super exciting. I feel like when we first joined this community, maybe there was chatter about treatments, but yeah, it's actually looking now like within the next few years, we could see something that would definitely make our lives easier. So that's what we hope ultimately for a cure, but we'll take just a treatment that makes life easier for now. And what advice I would give to new families, the best thing for us or for me has just been to connect with other families. I don't think I could have done this. Well, I know I couldn't have done this journey alone. So connecting and establishing relationships with other families in the community would be my biggest piece of advice.
Yeah, I know that was a game changer for me, is when I started connecting with other people just on the general low protein diet, and then getting to meet other homocystinuria families. It's like that missing piece that you didn't know was missing until you actually got it, because when I was diagnosed, there was no internet. So, and I remember like that first call with Liz. And so it's just, it feels like a lifetime ago and all that's happened. So it's really exciting to kind of see, like, because Elliot was in the hospital when I talked to you. So it's amazing to see how far he's come. Brittany, would you like to talk about the future and what things that you're excited for and advice?
Yeah, I'm excited like Liz. Like it's exciting. I mean, I I love this community, and I think being at that conference was such a great thing for my whole family, because when you have a diagnosis like this, it doesn't just affect the one person or the mom. It's the whole family. And my kids, my two girls who don't have homocystinuria, it's hard for them. And I like that they now have connections with other people who are siblings that they can make and help them, talk it out a little bit. I'm excited because we are, we're at a point. I just had the opportunity this past year to share with the community the research map and strategy we created for the remethylation disorders. So that's, the cobalamin disorders and severe MTHFR. I'm excited because we have been fundraising like crazy and getting our funds up. And I think we're going to see some exciting things in the community. There are researchers interested in the various cobalamin disorders and severe MTHFR. And I think now that we are building our community and uniting together, the researchers are seeing that and hearing it. And in turn, that makes them more excited to want to do more research. So it's kind of like, an ebb and flow of excitement, I think, in the community. It's going to be wonderful in the next couple of years. It's exciting. Our community is growing a lot bigger, and I think that there's going to be a lot of great things in the future. My advice would be to give yourself some grace. That, I hear Liz talk about, her son loves junk food. Well, it's all about balance, right? Like, it's so hard. Like, I think it changes your perspective when you have a child where you're just trying to fight every day to keep them alive, right? I don't really care if he eats broccoli every day. I want him to be alive. And it changes your perspective, and it changes, you just have to give yourself grace and take it one day at a time, and do the best you absolutely can, and find your own balance, because your life is going to look like all the other Instagram moms, and your life isn't going to look like maybe even mine as a mom with a homocystinuria. And that's totally fine. Like, you just have to find your happy place and give yourself grace that it doesn't all come at once. So
I think that's a very important message, because I think I know for the families that get diagnosed and they're like, how am I ever going to be able to do this? And then a year later, they're like, I'm doing this. And it's, you have to just find your routine. You have to find what works for you, your child, and your family. And it's going to be different, like you said, for everyone. And I know I have my brother with classical homocystinuria, and how we handle things is totally different. And I would never expect him to try to do things my way, because it would never, ever work for him.
It's true. I can't even tell you how many times people have said, I don't know how you do it every day. And I'm like, well, you don't, because you're not living it. But when you're a mom or if you are the patient who has to do it, you find it in you to do it. And it's just one day at a time. And then you know, you don't realize how strong you can be until you are, when you're in it and doing it. And then you realize, okay, I got this, you know, just give yourself a pat in the back every once in a while.
Exactly. Misty, do you want to go?
I'm excited for the research like everyone else. Obviously, it's not going to undo the damage that's already been done with Sienna, but it would be amazing for her not to have to take medication every single day. And also, I'm just excited that, you know, it's going to help the younger kids. I mean, they won't have to experience the hardship and everything that, you know, Sienna has gone through. So that's really exciting for me. Also, advice I would give, like everyone else said, get connected. I felt so alone. I did not find the OAA until Sienna was 12 years old. I had met one other family, thankfully, but we didn't see them very much. So I really felt alone. Once I got connected, I just can't tell you how relieved I was to know I wasn't alone anymore. You know, and I started going to conferences and just meeting families, and I've made some amazing friendships with these families, and, you know, it's so nice. And also too, if there are any organizations within your state that you can get connected with, that helps too. I'm connected with Lighthouse for the Blind. It's a really wonderful organization that does a lot of different things. There's another organization that for kids with disabilities or life-threatening illnesses, and they do tons of, they have activities every single day, from concerts to sporting events to just all different things. So just, you know, get connected, because it can be very isolating. You can feel very isolated. I know that, you know, as having a child with, you know, a disability, you're not able to hang out and do things sometimes like, you know, other moms. And then, you know, sometimes people, they just can't relate. Like Brittany said, they can't relate to it because they're not going through it. So, you know, it's kind of hard to, you know, make those connections. And even with, you know, friendships that you've had for many, many years, I've, you know, some people just, they can deal with, you know, it. So, you know, those friendships, I no longer have those friendships, but I'm so grateful for all of the amazing people that I've met through, you know, OAA and the, you know, HCU organization.
Thank you for that. I think we all can agree, being able to connect with each other is such a game changer. I think about that, like how great it would be for all families upon diagnosis to be like, hey, here's an organization or organizations that, I mean, double, like that's a crazy concept to me, because there was nothing initially. And here are some, you know, they can connect you with other families. Like it's such a powerful thing knowing there's other people that are living and doing the same things as you, and being able to get advice from them so you don't feel like you're starting from square one. Grace, would you want to talk really quick here about the future and what you're excited for and advice?
Yes, I am so excited for this possible research that, you know, I initially, when Carson was diagnosed, I thought it could be years. You know, she might be a teenager or older before anything, but now it seems like a real possibility. In the nearest future, we could be starting research, and it's so exciting. I even talked to one person who mentioned using a bacteria and putting it into a form of a gummy to help lower homocysteines. Different things they're playing around with. A gummy would be amazing, especially for the little ones. Brittany talked about the conference, about how great that was. It was so amazing seeing everybody, and not just that, meeting all of some of the leading people with HCU, you know, the researchers. I used that time to talk to every single person I could, trying to advocate for MTHFR to get things going, and I think it was, you know, it's helped kind of propel things. Message I would, for new families, of course, definitely reach out, after Carson's diagnosis. It's a struggle. You have to kind of go through this grieving process to take in everything. I feel like it took almost a year for me to wrap my brain around this and how rare it was, how severe it can be. I remember having these different realizations of, oh, this really is rare. Or if she doesn't take this, it can really be severe. She could die without that. It took a while to really, truly process all of that information and how severe it can be, also in relation to how well she's doing. It's difficult. You talk to these people about, or families and friends, about how she has this rare condition, but they look at her and they can't see that. They don't realize, the differences. But anyway, so I would definitely reach out to other people. Once I started connecting with other families, it helped tremendously. And do as much research on the condition as you can. That has helped me advocate for Carson so much. The first year, I solely listened to her doctor, which, yes, do that. Listen to your metabolic specialist, do that. But do your own research so that you can bring things to them, ask them, and they could tell you why that may or may not be a good route to take. So you could have this communication back and forth where it's not just them telling you what should happen. Have an understanding so that you can, not necessarily question, but better advocate for what would be best, for open communication both ways. That has helped me.
Yeah, I think that's a really good point. And it's not just even about the research, but being an active participant in your healthcare. And your child's healthcare, and so just be an active participant in your healthcare, in your child's healthcare. Be an advocate for them. If you suspect something's off, don't be afraid to speak up. But with that note, it doesn't look like we have any new questions in the Q&A, and so I appreciate our panel for taking their time today and sharing their experiences with the homocystinurias. I think the one thing that we can all realize from today is that, even though there are these individual conditions, that there's so much shared experiences between the obstacles, the successes, the initial grieving stage that takes place, but also, the excitement that comes with where things are. It's an incredible journey, and it has a lot of rides, but the great thing is we have a very supportive community across the board to help us along the way. So if you have questions about your child's diagnosis, or you would like to get connected, I think anyone here would be more than glad to speak to you. And so we are here for you. And